All right, so the next stage after you chew your food up and form a nice bolus is that you can swallow. And swallowing is at first voluntary. So the first step is that you decide to swallow, and when you do that, it's a voluntary thing. The other word that we use for swallowing in this class is deglutition. So we're going to talk about the steps of swallowing. So first you have this buccal phase of swallowing. Here is the bolus of food. So assuming you've chewed it up nicely, it's become a ball of mass of chewed up food. And what you do is you take that mass and you put it towards the back of your mouth with your tongue within the oropharynx. So this part of the throat is where it's going to go first. So during this phase, the upper esophageal sphincter is contracted or closed, and the tongue presses against the hard palate, and that forces that food bolus back into the oropharynx. During the second phase of swallowing, which is not voluntary, it happens involuntarily. So once that food bolus hits the oropharynx, everything after that's going to be involuntary because you don't want to get stuck in this phase or you will choke. Because look here, this is your larynx and your trachea. This is where air is supposed to go. And during the swallowing step, if the food gets caught here, you won't be able to breathe. So it's very important that this happens smoothly and that you don't have to think about it. So here's the bolus of food. It's going through the oropharynx. And at this point, the tongue blocks off the mouth. The soft palate, here's the tip of the soft palate, the uvula, is going to rise and close off the opening to the nasopharynx. So you don't have food coming up through your nasopharynx and then out your nose, because that's yuck. And we all know that you've probably had a situation in your life, especially with liquids, where you're laughing or something while you're trying to swallow, and the milk or whatever it might be comes out of your nose. The larynx rises so that the epiglottis, which is here, that's that cartilage flap, will fold down and block the opening to the trachea. And that way, the food, as it's going down past the oropharynx and into the laryngopharynx, is not going to enter your windpipe because that will cause you to choke. At that point, once it gets beyond the larynx, it's entering into the esophagus, which again is posterior to the trachea. And that leads to the pharyngeal esophageal phase of swallowing, where the food bolus basically passes the upper esophageal sphincter here, which closes, and enters the esophagus, and peristalsis is going to move that bolus down and down and down further through the esophagus until it enters into the stomach. So you get circular muscle contractions that will move the bolus down, continuing down. Longitudinal muscles contract here, and that's how peristalsis works. And then the gastroesophageal sphincter is closed at this point. Sometimes they call that the cardiac sphincter. But peristalsis is going to move the food through the esophagus, and it's going to open this and enter into the stomach. So gastroesophageal sphincter will open when food reaches that region, and the food bolus enters into the stomach. After the food enters, the sphincter will close, and hopefully that will prevent what's called gastric reflux, which is often lovingly called heartburn.